The numbers are staggering. More than 12% of Nevadans have diabetes. That's close to 300,000 people in our state that are managing a condition with serious consequences. Joining us now to discuss diabetes in detail from P3 Medical Group is nurse practitioner Diana Kirby. It's great having you.
Hi, thank you. I'm glad to be here.
Very happy to have you. It's just sad to be talking about this, unfortunately, but 12% of Nevadans are diabetic. What exactly, we all hear diabetes. What exactly is diabetes, and why is this becoming so common?
Well, diabetes is an endocrine problem. It's where your body has difficulty manufacturing an appropriate amount of insulin, and therefore you have too high of a level of glucose in your blood. There's a couple of types of diabetes. You've probably heard of type 1 diabetes, which is often called juvenile diabetes or insulin-dependent diabetes. That's the least common type.
Yeah.
It occurs in about 5 to 10% of all people with diabetes. In that condition, it's an autoimmune problem where the pancreas cells die out and the pancreas loses its ability to produce insulin. Therefore, if you're a juvenile diabetic or a type 1 diabetic, you need to have insulin replacement.
You need to supply that insulin. Yeah.
Right, you have to supply that insulin daily in order to survive. But the much more common type of diabetes is type 2 diabetes. That occurs in about 90 to 95% of all diabetics. They're the type 2 rather. There are problems with type 2 diabetes that can be very serious. That's why it's important to try to control it.
The problem is a lot of people with diabetes might not even realize they have diabetes.
Right.
Why is it so important to control it?
Well, you know, type 2 diabetes, your body is producing insulin, but it just isn't able to utilize that correctly to get into the cells as it should. So it's really important to control diabetes because it has some pretty serious clinical manifestations. If you don't know that you have diabetes and you go on for a long period of time, your blood sugar levels become higher and higher, and they're not controlled, and it can lead to things like visual loss, kidney dysfunction. It could lead to peripheral neuropathy. It can lead to skin infections. It can lead to problems with circulation, and it can even cause something as serious as an amputation. Wow.
The 12%, obviously that's a big headline, but we're kind of burying the lead here because there's estimated around 40% of Nevadans are pre-diabetic. So what can we do to prevent the onset of diabetes if we're seeing it in our, in our view? What can we do to kind of stem that tide and be able to stay out of that?
Well, I think one thing to do is to look at your family history. Do you have a family history of diabetes, which would make you more prone to it? And to see your doctor, to get a checkup and to be tested for diabetes. It's a blood test. And that can be done very easily. We see a lot of diabetic patients at P3. One thing of interest in Nevada, we do have, I think, a little bit higher incidence here because we have a larger senior population.
That's true.
And as you grow older, you're more likely to develop diabetes. We also, unfortunately, have several people who are obese in the state and people who smoke, and those also increase your risk of developing diabetes.
Absolutely. Well, definitely it's worth going into your doctor and discussing this and hopefully getting on the right path. Speaking of doctors and healthcare, Medicare annual enrollment is actually underway. It's going through December 7th. This is a very important time for seniors and their healthcare, isn't it?
Absolutely. It's important to get enrolled. One of the options to look at if you might have diabetes or are at risk for diabetes is to look at the Medicare Advantage Advantage program. It's a nice option. In the long run, it can save you some money, possibly, on the treatment of your diabetes. But most importantly, I think it opens up a lot of benefits and services to you that you wouldn't have otherwise.
It's pretty surprising. A lot of people, I've heard about the Medicare Advantage plans, and you're actually, gym membership can be a part of it. A lot of cool stuff can be a part of it.
Right.
It's great having you. Thank you so much.
Thank you. Thank you so much.
All right.
It's nice being here.
It's been a pleasure to have you. Get on track. Prevent or at least manage the diabetes with the help of P3 Medical Group. Today we feature their Pecos location in Henderson. To learn more, visit the website or call the number on your screen. P3 Medical Group is a proud sponsor of the Morning Blend.